Ladies and gentlemen, hello. There is humongous news in the health insurance world that is going to affect a lot of people all across the country. Big changes to the what we call the short-term or non-ACA market in health insurance. Okay, in my opinion, it's a very bad move, but we'll get into it. I know other people are going to think it could be a good move. I tend to lean towards having freedom of choice in what's available in the market and not restricting people's options. But there are certainly positives, I guess you can look at it that way too, to this change in rules. But so here's the thing. Short-term or non-Obamacare, non-ACA plans are going to be limited now to 3 months of coverage, okay? Now there's a little bit more to it. I'm going to go through a little bit of the history of the ACA and then what short-term or non-ACA is and some of the changes that have happened over the years. It's kind of been a battle between the right and the left, or the liberals and conservatives, on the best way to run health insurance in the country. So I'm going to give you a very quick rundown, okay? And then we'll take it from there, and then let you know that if you are relatively healthy, if you're on a short-term or a non-ACA plan now in certain states, you probably want to get in touch with me, and we might want to lock in coverage for 12 months to 36 months as soon as we can, okay? And this will all make sense as I go through here. So in 2010, Obamacare, or the Affordable Care Act, passes, okay? 2014, actually the end of 2013, so open enrollment, the first year for 2014 plans started, again, at the end of 2013. That was the first year the ACA went into effect. If you were doing health insurance at that time, it was a mess because the website was trash. It didn't work. The government kept having to extend the deadline. People couldn't enroll for like 6-7 months. Complete disaster. Okay, but the ACA came with some good things. Number one, all these essential health benefits. So the government can never deny you for pre-existing conditions. The plans had to cover certain essential health benefits like free preventive, maternity, mental health, all these different things that the government said these plans must cover all of these different services, okay? So that was good, especially for people that were dealing with pre-existing conditions, all right? Now, non-ACA or short-term plans were still available at this time, okay? And these are a very good option for people that make too much to qualify for subsidy through the ACA and aren't dealing with any significant health issues, okay? Because these plans tend to be a lot less expensive than the ACA, much bigger PPO networks, people that are traveling, travel nurses especially, people that live and work in different states or have 2 homes in different states. These non-ACA or short-term plans were a fantastic option, okay? Now in 2016, I think at the end of Obama's term, they restricted these non-ACA plans to 3 months, okay? So this happened. What's happening now kind of happened before. But a lot of the insurance carriers got kind of smart, and they were allowing people to sign up for a 3x4, where in essence, the plan would auto-renew 4 times throughout the year, and you would get yourself a full year of coverage. Now, the deductible would reset every time. It wasn't a fantastic option for anybody, but it did still give people access to these types of plans. And it was still a better option oftentimes for certain families that were relatively healthy, that were looking at $2,000 a month premiums on the ACA versus some of these plans could be $600, $700, $800 a month, okay? Then 2018, it was 2017 or 2018, Trump overturns that change, okay? And he says, not only are these short-term plans coming back, but states have to allow 12 months all the way up to 36 months of coverage. So in other words, you could write a plan and it would auto-renew for 3 years. So if you were diagnosed with something year 1, they would cover it for year 2 and year 3. It gave people longer term lengths, which is always good, okay? Now, so, most states adopted these rules. Florida, Arizona, South Carolina, Oklahoma, Texas, probably 35 to 40 states adopted these rules as is. A lot of the liberal states pushed back, Illinois, California, New York. Other states have certain restrictions where some of them didn't even allow any of these plans to be sold, okay? Or some of them said you could only be on a short-term plan for 6 months. We're not going to allow the 12 to 36 months. That's how like Illinois and Michigan do it. So You know, it's been this constant battle back and forth, and now here we are in 2024, where we're going back to this 3-month restriction. The way the rule is exactly stated is you can sign up for a short-term plan for 3 months, and you can renew it for 1 month if you need to. What they're in other words, if you're they really only want people on these plans when they're in between work coverage or they just need something for the time being. So they're giving you basically 4 months total of coverage. After the plan ends, let's say you write a short-term plan with United, or you get on a short-term plan with United. Once it ends, you cannot get back on that same plan for 3 or 4 months for an entire year, okay? So what we were doing in a lot of the 6-month states like Illinois is you could flip-flop carriers every 6 months, because Illinois, Michigan, they had restrictions where you can only be on one carrier for half the year, basically. So there was always ways around it. Now they're restricting so that you cannot re-enroll for the same company without a year gap, okay? And it's just not a good experience if you wanted to stay with a non-ACA or a short-term plan to sign up for different companies every 3 months. Because number one, they don't have to cover any major pre-existing. So if something happens health-wise, month 1, 2, or 3, and we're looking to switch carriers, you might not have to be covered through the non-ACA plans, right? So that's where it currently stands. This rule goes into effect on September 1st. So any plans written after September 1st, we're going to be under these new rules unless something changes. Now, who knows? Trump could win the next election. Who knows? RFK could win. I don't know. We're back to 2016 again with these Biden versus Trump. But if Trump does win the election, taking politics out of it, I don't necessarily care who wins, but if he were to win, they could go back and we could roll back to the 12 months to 36 months again. You know, that's just how it could go. But as things stand right now, if you are in a state that allows 36 months of coverage, again, the states I'm licensed in, like Florida, Arizona, Texas, South Carolina, North Carolina, Oklahoma, Indiana, Ohio. I'm just thinking, and of course there's a lot of other states that allow this as well. I'm just not licensed in them. But for states like that, you want to get in touch with me right away, and we can lock you in anytime. As long as we write the plan before September 1st, we can lock you in for 36 months, okay? Because a lot of you are going to want to avoid going into the much, much more expensive ACA plans, okay? Now, the government wants people in those plans because they want all the healthy people that might take care of their health better, might eat better, might not smoke and drink and do all of that stuff. They want all those people to pay for the sicker people. Now, don't get me wrong, a lot of people don't choose to be sick, right? There's a lot of chronic health issues that are not anybody's fault. But what the government, I think, misunderstands when they force people into this system, this Obamacare system, is that people are not going to be willing to spend so much more for the same or crappier coverage with higher deductibles and smaller networks. Because the ACA, for all the good, there are a lot of issues with it. A lot of those people, a lot of healthy people, just wanted coverage for the catastrophic. They wanted to be in a big PPO network. They wanted reasonable deductibles. That's what the non-ACA or short-term gives us. So, like I said, reach out right away, 708-566-6589. Shoot me a call or text, or feel free to look in the description of the video, message me on Facebook or wherever else you can find me. Thank you very much.